So today we're going to listen to Rudy's heart and lung sounds. Okay. And I was counting on the seconds on the clock on the wall there for that third hand. I'm just going to do the math real quick. His heart rate is 80, which is in the normal range, and for him being as excited as he is, I was expecting to feel it more. But he had normal heart sounds, he had that good love dub sound. I didn't hear any more, so I'm going to go back and continue listening to the rest of his heart sounds to check on the other side.
So here's the weekend. You might have 1 or 2 glasses of wine, all right, and you like to keep it cool. Wrap it with ice cubes in it and have it watered down as the ice melts. What they're saying now is you should freeze grapes and then put them in your wine.
Yeah, on both sides it sounds very good. When you listen for her, you kind of listen for that love switch sound. It's just the bell's not closing all the way properly. If you were to hear an abnormal sound, I would definitely want to alert the doctor right away. And now we're going to go ahead and listen to his lung sounds.
Also, Stacy posted Humble, Texas. She says, don't pronounce the H in Humble, Texas, spelled with an H. Named after Pleasant Smith Humble, who opened the first post office in town. I am wondering whether this is true or she's just having us on. Also, Farmington, New Mexico.
His lung sounds very good. He kind of painted in between there, but he's pretty excited and worked up, and then he's in the higher range, but like I said, he's still pretty excited and panting. Everything sounded pretty normal where I was listening at.
On our Facebook page, you can put it there as a post, you can send it as a message, you can tweet it at SiriusXM Pulse. If you'd like to do the snail mail, we have a couple of addresses. One of them that will get you get it to me would be 1500 Eckington Place Northeast. That's in Washington, D.C. 200.
No wheezing or crackling or like popping sounds. If there was wheezing, you can sometimes hear that. When they're either breathing or panting like so. Any of the wheezing, popping, or crackling sounds is very bad. You definitely want to alert the doctor right away, but we just got an excited dog here. Just like in pant. For our EKG, our nice patient here, she is already in right lateral recumbency, which is the position you want your patient in. We're going to go ahead and place the leads. So the right one is going to go on the right front leg. And then typically, if we had a black one, which we do not, it would go on the left front leg. And then you do your green one on your right rear leg. And then your red one on your right leg. So it's okay, sweetheart. Then you're going to go ahead and apply alcohol because it's a good conductor. And we can turn the machine on. And then it should start to show us a good EKG reading. And it should have a P, Q, and then the R, T, S for your EKG reading. She's a little excited. To minimize artifacts and make sure your dog's not panting or they're not moving. But she's very excited, so she's going to have a higher EKG reading. This is the rating quote they were going to demonstrate once again on a friendly dog. Usually this would be like almost last case scenario. This is used on very aggressive dogs, and it is also for the safety of not only the technicians and doctor, but as well as the dog, because it's a safety concern in general. So this is how you kind of restrain them. And then you pull tight. And then this way, when the dog's fighting and thrashing around, they can't get away. So we're going to go ahead and do the catheterization of a male dog. I have my sterile catheter. And my sterile lube. I have a brand new tube of lube, so it's completely sterile.
Did you put that injectable on the door?
And then I have my sterile syringe. So I can draw the urine up in it. And to make it so it fits in here, I'm going to cut part of the tip off. so that it attaches to a syringe. And then I'm going to go ahead and clean the area. I'm going to go ahead and insert the tip of the catheter. Just slowly and gently insert the catheter into the urethra.
Oh boy.
Good job, buddy. Good boy. And then I should be able to draw out a little further.
He might not have any urine either because he was
Then we're going to
outside.
try some urine to see if he has anything in there.
He just went potty soon.
He obviously doesn't have anything there. He was just outside. So here our cat. So I just use some alcohol to clean the area. And pull him back and we have some urine in here. We're going to do our dog Rudy's anal glands here today. I got my glove on. I'm going to go ahead and use some lube. This way it makes it easier for him. I'm going to go barely in there. And I'm trying not to squeeze at 4 o'clock here. Not a whole lot there. I got poop.
Did you know that when you switch channels, it makes your lane slow down? Just saying.
Just a little bit of material on that right one, but nothing in the, I'm sorry, just a little bit of material on the left hand side, nothing on the right hand side. So we're going to go ahead and clean his butt up here with some more shampoo. This way when he goes home to his owner, his butt doesn't stink. And then we got some smell good spray. Make it smell great. Okay, so today we're going to do our topical medication here on Rosie. She's a little over a year old. She's 77 pounds, so we got the extra large dog Advantix for her. She's due for her flea topical. I'm just going to open it with the cap here. And on a dog, you want to spread the hair between the shoulder blades and put the medication all right there. We would also advise the owner not to pet there for a few hours. And on a cat, you put the medication towards the base of the skull so the cat can't lick it. However, dogs are not quite that flexible. So we're going to do our ear cleaning in the dog. And then I'm going to massage it in there. I'm going to add a little bit more. Now I got a good squishy sound going on. Massage that in there really good.
I'm sick.
I'm going to take some cotton balls and clean it out. I want to make sure I get any dirt and debris out of the way. Yeah, she is. And then I'm going to go ahead and apply some medicine to his ear. I'm just going to apply a good amount in there. Rub that in there very good. And then we repeat it to the next ear. This kitty's ears today. We got our cleaning solution. Here we got the pin on the ear. So I'm going to squirt a good amount in the ear. And then kind of squish it around. And you like hear a good squishy sound. And you're going to take some cotton balls and clean out all the debris. a Q-tip and just kind of clean out the edges and the crevices of the ear. But you don't want to go into the ear canal with the Q-tip, because you can damage the eardrum. And then for treating the ear, because it's got some ear mites, I'm going to put some ear mites on some of his ears. So you want to push it down so it opens it in there. And then the whole tube gets applied in the ear. And then make sure you apply it. It's better to ear canal yesterday and stuff. And then you want to massage it into the ear. It's harder to touch.
Okay.
So now we're going to do our shimmer tear test here. I feel it from the right side. And with this, I want to open her bottom eyelid. And I'm going to want to hold it there for like 60 seconds. And this will give us a good, accurate reading this way. We are testing her tear production to see if she's got dry eyes or if she's providing the correct amount of lubrication for her eyes. I know, you're being very good. Yes, you're being very good. Keep it in there. Keep it in there.
10 more seconds. That's okay, there you go. You got it.
Alrighty. So our reading is about 19. So she's going to fall in the normal range. Usually you would test both eyes to see if the left or right eye is comparing the same if they're both in the normal range, because the left and right can have two completely different readings.
Okay, you ready?
Usually you want to do it about 3 times to get a good average. She's running about 17. You're checking the pressures in the eye with the tonal pen. Make sure she doesn't like coma. But this tonal pen, it doesn't need to be calibrated. It automatically does it. It's on the fancier side, I guess. Different tonal pens vary in how they need to be calibrated. Okay, get that going. So I'm going to go ahead and put our eye numbing meds in. Give that a second to work. It works fairly quick. It's just way the dog doesn't feel the tonal pen touching his eye. So we're going to do our stain test now. We got the staining solution here. Just be very careful not to touch the tip to her eye because that can cause bacterial growth in here and can be contaminated. I'm going to go ahead and flush the eye now. If she had any cuts or abrasions in her eyes, it would highlight that a bright yellow. So I gotta flush that excess stuff out. Usually for this you'd have the lights off and then you would shine a light in her eye to see if anything would be glowing, if she had a cut or anything in there. Make some more flush. And then for our tonometry, go ahead and prepare our enema. We have it closed off so that it's not leaking out here. And I'm going to go ahead and open up our sterile lube here. And we're going to put an adequate amount into the bucket here. And then we'll put an adequate amount of dish soap into the bucket as well. And then we're going to use some warm water so it's not too cold for the patient. And since you're doing a big dog, you're going to want it really full. And that's how you prepare it.
Okay.
So we're going to go ahead and do the sterile lube. And then we have a marked here, so it's only going in a few inches because you don't want to go in too far. You only have to go as far as the marked line, and then after that we would go ahead and open our clamps to administer the enema. A few fluids here on our patient. So I'm going to go ahead and tent the skin. And start at the base of the tent. And then I'll turn the fluids on. And you can measure how much fluids you're giving by monitoring the lungs on the IV day. And this will help with hydration of the patient. And then usually you want to go into this nice, like lung here. And then when you're done with the fluids, you can just go ahead and shut your IV bag off. Grab your cap. And then pull it off so no water leaks out. We modified Robert Jones bandage. So we have our turn presser here with our tape. So we go ahead and make our stirrups. Where the tent just got a boo-boo. So you would clean it, maybe some antibacterial stuff on there. Then we got some rolled gauze, or cotton I mean. And then you want to, when you're wrapping it, you want to wrap it at least 50% over. So you want to go up as high as you can. Make sure it's nice and flat, so it shouldn't have any pressure points. And then I'm going to rip that off. And then I go ahead and start our rolled gauze. I want to make sure you don't do it too tight so she doesn't lose her circulation, but I don't want to do it too loose either where it's sliding all around. Once again, same procedure, overlapping by 50%. Okay, and then I'm going to flip my stirrups over. And I want to do a little twist. Seal that side down. I'm going to do the same thing with this side here. Just a little twist. And then flip this piece all the way up as well. And then I'm going to take my vet wrap. And I'm going to do the same procedure of overlapping by 50%. And then seal that down, and then I'm going to go ahead and grab my elastic tape. And I want to tape it down just so her two middle toes are sticking out. Look at the bottom, like that. I have issues playing with these scissors from a left-handed person. And then I'm going to go ahead and repeat that up top so that it doesn't slide down. You're doing so good, sweetheart. And then that way, so we just have our 2 bottom toes sticking out here at the bottom. But she's all bandaged and ready to go. Okay, so now we're going to go ahead and remove our bandage. I got our bandage scissors, which has a blunt end here so that way we don't cut her. Kind of loosen some of the tape around her feet. Like I said, I'm a lefty, so scissors here don't usually like me. And then I want to be careful. If she were to have a wound, I'd want to be extra careful near that area. Yeah. 60 to 500, it's 2 twice a day. Alright, and then you want to be careful about pulling any hair off. And there we go. Alright, so now we're going to go ahead and show a simulation of a swim with a modified Robert Jones. So first thing we're going to do is start with our tape again. We have our tongue depressor here already in the middle, tape's ready to go. And then we're going to start with our rolled cotton. And then I want to make sure I overlap it by about 50%. Now you're with the split, it's just like a modified Robert Jones. You go in just above her elbow. Then I'm going to go ahead and use some elastic gauze. Once again, make sure you don't fight it too tight or too loose. And then this splint would usually technically be, we cut it down to fit her size. We cut it just before her elbow, but because this is just for stimulation purposes, and this is still a very good splint that we could use in the future, we're not going to cut it, but like I said, we would cut it, and you'd probably cut it right about here. So we cut off right there at the top, and this would be gone, so that it's not in the way. But for demonstration purposes, we're going to keep it long. And then I want to get my tape, make my stirrups so I can have pop stick. And I want to twist it just a little bit. Alright, and then I want to put some gauze to create like a padding between the splint and her elastic gauze. And you can use even toilet paper or paper towel for this. And then since we would be cutting this off, we would put some cotton on that edge, so that way that edge is not poking at the dog, because we try to smooth it out as much, that way the cotton is covering that area. And then to finish it off, we're going to be using our vet wrap. And then we do vet wrap. The split, once again, overlapping by 50%. Okay, sweetheart, we're almost done. Almost done. Once again, just going over the elbow area. And then you're going to take our elastic tape. So that way the bandage stays on and doesn't start sliding around. And we're going to do the same thing for up here. You're okay, sweetheart. You're doing a very good job. We got a little overflow right over your over. And then we have our modified Dodge Jones for a splint. Her true coat is just barely picking up on the cotton little waves are so tiny. We're going to go ahead and remove the bandage with the splint. Using my band scissors with the blunt end. I'm a lefty, so I'm doing this backwards for me. This part is not quite very good, so we just try to bring it over more.
You're alright. Okay, it's a good girl. That's a good girl.
Easy, sweetheart, easy. And then we can pull it off the rest of the way.
It's a good girl.
On the little dog Sky, we did use this splint that's for the front leg. Plus, it was closer to her size. We always want to get a splint that's close to the dog's size. This one would be way too big for her, but this would be used on a dog's rear leg. Actual manual dental scaler. So if I was to use this like a manual dental scaler, I want to make sure I don't use it at a 90-degree angle, and I would be scratching the tooth to get any tartar off. I make sure I do all sides of the teeth. When I'm on this side of the mouth, I want to make sure I do the inside surface of the teeth. But we have the ultrasonic scaler, like I said, we don't have an actual manual one, so that was for demonstration purposes. With the ultrasonic scaler, you don't make sure you don't use over 3 seconds per the side of a tooth. You can always go back and finish the tooth. The water helps to clean and moisturize and cool down the instrument so that it doesn't get too hot for those teeth. And then for your fluoride polishing, for your polishing, I mean. Do I have to switch this over?
Yep, the first switch, click it once.
I want to spin it a little bit in here, get some of the polishing on there. And you want to do this once again, each tooth, only for a couple seconds. It doesn't need much contact time because it's ultrasonic. And this seals and protects the tooth, makes it shiny, and gets rid of all the scratches that we created when we were doing the ultrasonic cleaner on there when we were moving that plaque. This smooths those surfaces over so it doesn't get more bacteria stuck in there in the future. Fluoride treatment, first thing you want to do is you want to shake it really good. And with the fluoride treatment, you want to spray it evenly on all the teeth. And then we would repeat the same thing on the other side. And you want to let it sit there for 1 to 3 minutes so it has good contact time. And that will help sustain the dental that we just did to keep the teeth cleaner longer. And then 1 to 3 minutes, you're going to go ahead and you're going to wipe it off the gauze first. Wipe it off the gauze, and then you're going to rinse it. You repeat this to the other side of the mouth as well.
Want something stuck up my nose?
Now we can rinse it. Once all been rinsed good, we would be all set for care. No matter what kind of surgery we do, we always do a print-off sheet showing any teeth that may have problems, and we go over this with the client. This also lists the type of anesthetic and induction agents that we use as well. It talks about the monitoring and how the patient was completely normal. All the heart rates and respiration rate was all within the normal limits. The main part we're talking about today is at-home dental care. On our sheet, we talk about how it's important to brush your pet's teeth. So usually we tell the client, depending if you got a small dog or a large dog, will depend on what size bristle brush they need. We always tell them to use a soft bristle brush because you don't want to use one that's going to be hard and abrasive. And you don't want you want to make sure you tell the client to not use a human toothpaste because that can make them very sick. We do make specialized formulas for toothpaste in pets. You tell them usually just make sure they're getting the outside of the teeth. That seems to be the most important. The caudal buccal side of the teeth tend to get the most plaque buildup on them. There's some clients who are unable to use a toothbrush, or when their puppy is young, we recommend like massaging the gums, or you can use a finger brush. For the ones that are unable to use the finger brush or the toothbrush, we recommend at-home dental treats, the TD Science Diet formula that has that enzyme to break the plaque and bad breath down. And there's a variety of scrape the plaque. We always tell them to get some with like ridges in it to help scrape at the teeth. We recommend hard food because once again it's scraping the teeth compared to your soft food. And for the ones that have a hard time giving their dogs treats or brushing their teeth, we recommend at least doing like the oral rinse additive that you can add to the water. Obviously you want to monitor your pet. A midstream sample. She did a really quick urination for us, so she didn't pee a whole lot. You'd have to probably wait for her to go again or wait till her bladder's full because there's not a whole lot here in our cup here. But we used a clean ladle-like thing to catch the urine, and basically for your pre-catch you just let your dog go and catch it midstream. The importance about catching it midstream is to make sure that it flushes any bacteria or anything on the outside out, and that way you get like the best sample possible. So we're gonna go ahead and trim her nails here today. She's just a little puppy, so she doesn't have a whole lot for nails. Good girl, Zoe. Good girl. Yeah, nice trimming. Nice trimming their nails. Here anyway. Good girl. Hi. Hi, I know you're gonna give me kisses. You want to just kind of, you don't want to cut the quick, you kind of want to go at the curve, and you want to make sure you get the dew claws too. Your little dew claws. And with her nails it's hard because you can't technically see the quick because she's got the black nails, and dogs with the clear nails you can visually see it. Stay still, sweetheart. Hi. Hi. Hi, go still. Let's still. Let's go this way. One more. Two more. I got this. Yeah. There you go. She's a good girl. And nearby I had the quick stop powder just in case I was to cut a nail. And we also have the nitrate sticks, but we prefer to use the quick stop powder here. Go ahead and do our nail trim on our cat. Just like the dog, you want to make sure you don't cut the quick.
Oh, I don't know. I don't think so.
On the cats, you want to make sure you push the nail out because their claws are retractable. And you want to do this in all 4 feet. This cat's nails are easy to trim because they're clear. You don't want to forget your dew claws. Just like the dogs, you want to kind of end where the arch begins, or ends on towards the quick side, I should say.